Student, today we are going to discuss an important topic in surgical area. It is burn wound care. I'm a clinical instructor, Hanan Radwan. Outline: we are going to talk about hydrotherapy, debridement, and burn wound dressing. What we should know in hydrotherapy. Hydrotherapy, we will know what's the meaning of hydrotherapy, what is the purpose of hydrotherapy, procedure, debridement, what is the meaning of debridement, the purpose, and the types of debridement, types of wound dressing. What is hydrotherapy? Hydrotherapy treatment involves the use of warm running water to help the healing process of burn injury by reducing infection and relieving pain. This picture of hydrotherapy room. This hydrotherapy tub. What is the purpose of hydrotherapy? The first purpose is removal of all the dressing from burn wound, cleaning the wound through removal of non-viable tissue, assessing the wound, providing range of motion exercise and patient comfort, as well as body pose. Promote wound healing. Is a picture of burned patient in hydrotherapy room. The first purpose is removing of all the dressing. It helps nurses to make burn care by removing devitalized and necrotic tissue from the burned area through debridement. It also helps the patient to participate in the caring process by making full range of motion activity during the procedure. Steps. At the beginning, if the patient is ambulatory, the wound can be cleansed in a shower. The wound of non-ambulatory patient can be cleansed using shower carts, mobile stretcher made with removable sides, trench holes, and positioning capabilities, as this picture. Retractable shower hoses suspended from wall and ceiling provide the nurse with easy access to water source for washing the wounds. Unstable patients may have their wounds washed at the bed. Total immersion hydrotherapy is rarely performed because of the high risk for infection and sepsis. This picture is total immersion of the person in hydrotherapy tub. Then the use of plastic liner, water filter, and through decontamination of hydrotherapy equipment and wound care areas is required to prevent cross-contamination. This that we call environmental preparation. The temperature of water is maintained at 37.8 degrees, and the temperature of the room should be maintained between 26.6 and 29.4. The duration of wound cleansing and dressing change is determined by the patient's ability to tolerate the treatment and to maintain a satisfactory body temperature. During the bath, the patient is encouraged to be as active as possible Hydrotherapy provides an excellent opportunity for exercising the extremities and cleaning the entire body. When the patient is removed, any residue adhering to the body is washed away with a clear water spray or shower. Unburned areas, including hair, must be washed regularly as well. At the time of wound cleaning, all skin is inspected for any hints of redness, breakdown, or local infection. Hair in and around burn area except the eyebrow should be clipped short or shaved to prevent transmission of infection. Intact blisters should be left alone and debrided only if they ruptured or break. When non-viable loose skin is removed, aseptic condition must be established. Then we will start making dressing, our sterile procedure. Wound cleansing is usually performed daily in wound areas that are not undergoing surgical intervention. Mechanical debridement can be performed to remove loose non-viable tissue. After the burn wounds are cleaned, they are gently bathed dry and the prescribed methods of wound care is performed. Patient comfort and ability to participate in the prescribed treatment are also important consideration. During the treatment, the patient is assessed for signs and symptoms of hypotension such as chilling, fatigue, changes in hemodynamic status, and pain unrelieved by analgesic medications or relaxation technique. At this point, we'll start to talk about wound debridement. What's wound debridement? As we said in wound dressing, after the patient going to hydrotherapy room, we start cleansing the wound, then removing any devitalized tissue and necrotic tissue from the wound. This process is called debridement. The goal of debridement are removal of tissue contaminated by bacteria, foreign bodies, thereby protecting the patient from invasion of bacteria. Removal of devitalized tissue or burn scar in preparation for grafting and wound healing, as we see in this picture. This called devitalized tissue and necrotic tissue. After debridement, it will pass by this step, then we will reach this step. It is a healthy tissue. This tissue is ready for grafting. What is the meaning of grafting? Taking a layer of skin from a donor part area from our body and we have types of skin grafting. This we will take in theory later on. What are the types of debridement? We have several types of debridement. The first is natural debridement, or as we say, autolytic debridement. Mechanical debridement, chemical debridement, or enzymatic debridement, surgical debridement, and maggot therapy. What is a maggot therapy? Maggot therapy is a small number of a special species of maggots are introduced into the ulcer. These eat only the dead skin and produce chemicals that promote healing. It's an insect. Now we will talk about natural debridement. What's the meaning of natural debridement? As we say, natural, it occurs spontaneously without any interference from anybody. It occurs naturally by the effect of autolytic enzymes under this tissue and the activity of normal healthy tissue under scar. This make liquefaction of the scar tissue and easing the separation spontaneously. This process take long time, so we don't use in burn for large space of the body. We can use this method when I have small burned area and not in vital tissue. Then mechanical debridement. What's mechanical debridement? Mechanical debridement, we use an instrument for removal of necrotic, devitalized and dead tissue by using artery forceps or forceps to hold this necrotic tissue and cutting by using a scissor. This process is done during hydrotherapy. We can also use a type of dressing that help in removal of devitalized tissue. This type is wet to dry dressing. Chemical debridement is in this type of debridement we use chemical substance or topical creams used to remove devitalized tissue from the wound and eases its wash away in hydrotherapy room. Surgical debridements, the patient taking anesthesia and going under surgical theater using surgical instrument for removing of all devitalized tissue in preparation for the patient for skin grafting. Maggot therapy, as we say, it's an insect or type of insect. Use special species of maggots introduced into the ulcers or wound burn. This eat only the dead skin and produce chemicals that promote the healing. What is the purpose of wound dressing? After we make hydrotherapy and debridement, in this step we make cleansing of the wound and removing of all devitalized tissue. Now the wound is ready to be covered. The coverage of wound that we call dressing. Why we make dressing for burned wound? The purpose of wound dressing: 1. To protect the wound from physical damage and microorganisms. Just a cover to protect from invasion of microorganisms. Be comfortable, compliant, and durable. Be non-toxic, non-adherent, and non-irritant. Allow for gaseous exchange and so on. Allow the wound to dry and heal. Allow high humidity at the wound. Be compatible with topical therapeutic agent. Can carry the therapeutic agent or topical creams that we make in the wound. Be able to allow maximum activity of the wound to heal without retarding or inhibiting any stage of the process. Methods of wound dressing. We have two main types of wound dressing. The first is open dressing or closed dressing, and each one have advantages and disadvantages. First, open dressing. The open method is a popular form of treatment for burn wound. It involves application of topical agent without the use of dressing. Application of topical agent without the use of dressing. We use no dressing. The wound is opened. Advantages of this open dressing: continuous observation on the assessment of wound, reduce possible hyperthermia, facilitate physical therapy, helpful in treating burn of face, neck, ear, and perineum. Disadvantages of open dressing: hypothermia. The patient is exposed to air current and losing of temperature. Require frequent linen and ointment. Can be used effectively in children and unconscious patients. The closed method, it involves the application of occlusive dressing over the burn wound. In this type, we use dressing. Occlusive dressing may be used over the area with new skin graft to protect the graft and promote an optimal condition for its adherence to the recipient site. We have two sites, donor site and recipient site. Donor site is the site that I take a layer of the skin, while the recipient site is the site where I put this graft. An occlusive dressing is a thin gauze that is impregnated with topical antimicrobial agent or is applied after application of a topical antimicrobial agent. Ideally, this dressing remain in place for 3 to 5 days, at which time they are removed. When occlusive dressing are applied, precautions are taken to prevent two body surface from touching, such as fingers, toes. We separate between fingers with a layer of dressing to prevent improper healing. These sites include fingers, toes, ear, and scalp, the areas under the breast, and point of flexion or between the genital folds. A functional body alignment position are maintained by using splint or by regular repositioning of the patient. Dressing impede circulation if they are too tightly wrapped. The peripheral pulses must be checked frequently and burned extremities elevated onto pillows. Extremities are always wrapped from distal to proximal to the heart. If the patient's pulse is diminished, this is a critical situation and must be addressed immediately. Procedure supplies. We will need these supplies and equipment for making wound debridement and wound dressing. All our supplies we should prepare and be ready to use in hydrotherapy room. We will use clean gloves, clean scissors, lipid antibacterial soap, water or bottle sterile water or saline or from hose in hydrotherapy room, sterile container, sterile field, sterile gloves, gauze 4x4, antimicrobial cream, ointment as ordered, mesh roll goes large or small rolls. Equipment for the dressing: sterile fine mesh gauze, 1% silver sulfadiazine, antibiotic ointment as ordered, non-adhering dressing, transparent wound dressing. Procedure steps: the first step is preparing the patient, explain the procedure to the patient, and provide the patient with adequate pre-medication with the analgesics as ordered 20 to 30 minutes before the procedure. Preparing the environment: our environment is hydrotherapy room. We should prepare as we list in hydrotherapy procedure. This room contain the tub that we use in hydrotherapy. This tub need preparation, cleansing, and disinfectant with antiseptic solution. Then is covered with a plastic liner. Then the temperature of the air is adjusted, temperature of the water is adjusted when the patient come. Preparing our equipment and supplies for making debridement and dressing of the wound. Preparing the nurse perform wound care should be aware with principles of infection control include the use of hair cap, mask, sterile gown, and gloves, as well as practice sterile technique during all procedure. All supplies will be set up using sterile technique. Transport or ambulate the patient to hydrotherapy room, as we listed before in hydrotherapy procedure. If the patient is ambulatory, يعني can walk to the hydrotherapy room. If the patient can walk to hydrotherapy room, we will let walk. If can't, we will use wheelchair or assisting the patient ambulation to hydrotherapy room. Remove the old dressing if present in hydrotherapy tub. Physical therapy exercise is performed with the qualified person at the end of hydrotherapy. During this procedure, the patient can participate in the procedure and help in removing all the dressing. The participation of the patient help preparing the healing process and making physical exercise. Once the dressing are removed, the patient burn wound are gently cleansed with gauze pad and then inspected. That we call wound cleaning and debridement. When washing wounds, the nurse use firm circular motion to clean cream, ointment, and loose skin. Be firm but gentle. Gentle but effective in removal of previous ointment and cream. The patient's unburned area are then washed. Wound dressing: after wound cleaning, the burned area are patted dry and the prescribed topical agent is applied. The wound is then covered with several layers of dressing. According to the type of dressing I will use with the patient, according to the patient condition. A light dressing is used over joint area to allow for motion, range of motion activity, and preventing contracture and improper healing. Unless the particular area have a graft and motion is contraindicated. A light dressing is also applied over areas for which a splint has been designed to conform to the body contour for proper position. Circumferential dressing should be applied distally to proximal to the heart. If the hand or foot is burned, the finger and toes, as we listed before, should separate for proper healing. Separate between skin that is in contact. Separate between fingers. Each finger is rolled alone. Should be wrapped individually to promote adequate healing. Initially, fingers which have circumferential burn should be traced with the fingertips. Exposed fingertips should be exposed for what? For assessing the blood supply to the wound and prevent any complication. Assess the pulse, temperature, the color, and sensation to prevent compartment syndrome and furthermore damage. To monitor neurovascular status, once edema has decreased, the fingertips can be enclosed in the dressing. Burn to the face may be left open to air once they have been cleaned and the topical agent has been applied. Careful attention must be given to ensure that the topical agent doesn't interfere with the eyes or mouth. A light dressing can be applied to the face to absorb excess exudate that might run into the eyes, causing irritation. This type of dressing that we call moist transparent dressing. Recording any observations in the patient wound and ask the doctor about any abnormal findings. Thank you.